So we've run our survey now for 2 years, the Living with Leukemia survey, and I think that's highlighted the real things that need to change for the care of blood cancer and leukemia patients specifically. And we found in that it's the financial and emotional support that's particularly lacking. So for financial support, we've actually brought in 2 new grants this year, starting from today, the 1st of April, to support with that area of things. So we can support patients financially to get emotional support via our new counselling fund, and we're also supporting patients financially with our hospital travel fund. So that's how Leukaemia Care is addressing that particular aspect. We're also bringing in a welfare officer to give people benefits advice and things like that. So we're trying to address that side of it quite well. And then in terms of emotional support, counselling in the NHS is available, but as I said, they are stretched. And we're trying to fill that gap with our counselling fund to enable people who would otherwise have to pay for counselling themselves to get funding to do so. So I feel that Leukaemia Care are effectively addressing the challenges we've identified in the survey. Chronic lymphocytic leukemia patients are sort of unique among all cancer patients, but blood cancer patients as well, in that they don't always start treatment immediately once they've been diagnosed. They experience a period of what's called active monitoring or watch and wait, and that's a perfectly legitimate clinical thing to happen, but we've identified through our Living with Leukemia survey and also other interactions with patients that it can have a particular emotional impact. So when most people think of cancer, they think surgery, they think chemotherapy, they think it can at least be treated and dealt with, and people often think cancer patients then move on and have the rest of their life. But with CLL patients, it can be worrying to be on watch and wait purely because they don't know what's happening during that period. Not being treated can feel like you've just been left to fate for a lot of people. So it's a particularly emotionally difficult time for people, and it's not been well recognised as a difficult emotional time. Our Watch, Wait, Worry campaign, we spoke to several patients with CLL who described feelings of worry, feelings of anxiety, and our survey identified that watch and wait patients are the most likely to be depressed or anxious following their diagnosis. So there's a key issue there that needs to be better addressed by support services.